Greetings and welcome to Raising Resilient Minds. I'm your host, Dr. Jihan, and I'm excited today to have Dr. Ranelle Lewis, who is a child psychiatrist, with me. One of the best things is that we're actually sitting in her newer office in Tulsa, Oklahoma, and it's wonderfully decorated, you guys. I wish you could see the whole thing. But Dr. Ranelle is a child psychiatrist. So for those of you who were not as familiar, that means that
it was 3 years and then 2 years from me.
Oh, wow. So how many years of schooling did you do?
So it was 3 years for adult psychiatry. I fast tracked into child psychiatry though. Nice. It should have been 4.
Nice.
And then another 2 years for child psychiatry.
Another 2. Wow. So that's 5 years to become a child psychiatrist. So as you all know, I'm always giving information and advice, but I will always defer to these highly educated individuals in this field. Okay. So if you don't mind, Dr. Ranelle, if you can just tell us a little bit about your new practice.
Yeah, so I took a huge leap of faith back in January of 2025. I had just kind of gotten burnt out with some of the traditional systems in medicine and was really led to do what I was supposed to do all along, which was start my own private practice. And I'm so glad to finally be here. I'm so grateful. I really enjoy outpatient psychiatry. I love the continuity, and then I love really seeing the impact that I make on people's lives. I'm seeing children all the way up to 65. I've even had a 75-year-old patient. And so I'm just really enjoying this space that God has called me to.
That is so awesome. And being able to do adults and children, you're able to see the whole kind of spectrum of where early starts of mental illness as well as later in life. And so as myself as a pediatrician, sometimes I don't see a lot of that. And so it's really important that we are paying attention to what exactly is going on from birth to death, right? In terms of our mental health. So I did want to ask you, when you think of the word resilience, what kind of comes to mind?
When I think of resilience, I just kind of think of getting knocked down and getting back up again easily, like just brushing things off and just kind of taking things as they come and kind of keep going, continuing to move forward.
Yes. No matter what comes your way.
No matter what that comes your way. I mean, life circumstances happen, things happen in family, things happen in life. Life is always going to life. And so just always keeping a positive outlook on life and just continue to move forward and not letting anything get in your way.
Right. And the reality is that part of the reason why I started this podcast is because I felt like so many children and families and just people in general, they don't have resiliency skills or they don't really understand what it is. And so when things happen, everything falls apart. And I've noticed over the years, increased rates of suicide and just increased rates of depression, anxiety, et cetera, because there's such a fear of the unknown, because we don't know how to deal with the unknown, right? We don't have that resiliency built in. And so I think it's really important for us to have these discussions and actually teach these skills to our children and their parents, because sometimes we as parents need to better understand that as well. So we talk about mental health disorders and things like that. How prevalent are they?
Well, for children, 1 in 5 children struggle with either mental, emotional, or behavioral disorders in America. And so what does that look like? That's like 15 million. It's 75 million children in America. And so that's like 15 million children. That's a lot of kids struggling with depression, anxiety, ADHD, oppositional defiance, conduct disorder, bipolar disorder even, sometimes schizophrenia, very rarely, but there's such a large swath of diagnoses out there that kids are really struggling with, parents are struggling with as well. And a lot of things are genetic and kind of run in families. And so I just think it's really important to break the stigma, be a little bit more open and transparent about mental health and different journeys, what it can look like for different individuals and families.
No, that's very important. So touching on the concept of it runs in families. And I think sometimes we want to hide it. I've mentioned before, I felt like the movie Encanto was so eye-opening because they were hiding Bruno.
Yeah.
Bruno had some mental health stuff going on. Bruno was struggling. Nobody was getting Bruno no help. They just locked him away, which is what our ancestors probably did back in the day. Uncle Joe, you don't go by Uncle Joe. Yeah. But it's like now we have treatment. So when you're speaking to patients or clients, how do you get them to understand, like, if you, especially adults, if you have this mental health disorder, don't be so afraid to get the treatment for your child.
Yeah.
Like, what does that conversation look like for you?
It's tough. I would say it's really tough because a lot of parents have their own poor experiences with mental health. And so that bleeds into how their children and how they're able to receive services, because it's tough when a parent doesn't trust. And if they don't trust, then they're not going to bring their child in, even if their child is struggling. But, it's a tough conversation to have.
It is. And I'm trying to figure out how we build that trust.
Yeah.
And I do understand there are some people that you probably shouldn't go to.
Sure. Well, not all doctors are created equally. That's the difficult part. Not all therapists, not all teachers, not all presidents.
Right. There's a lot
of variability between different people and how they experience the world. And so that leads to misdiagnosis as well. But what I found the most effective is education and getting curious about what do they understand about the disorder that I think is going on, and just kind of explaining criteria, explaining why I think their child meets criteria, explaining what those criteria are, and then also getting curious about what their experience was and what they didn't like about it. I like to understand everything about how someone is thinking about or what baggage they're bringing into the appointment, so that I can try my best to smooth things over, help them understand in terms that resonate with them.
And definitely.
Also kind of trying to explain mental health is comparing them to medical diagnoses. If your child had diabetes, you would not treat their diabetes. If your child broke their leg, you would not let them sit at home with a broken leg. It's the same with the brain, and the brain is the control center for everything. And so when our emotions are poorly controlled, they affect us in more ways than one. Our functioning in school, with friendships, with family, and some disorders and some mental health symptoms can really impact the whole entire family.
And that's important, right? The whole family's impacted. Earlier, actually today, I had a family and they were like, because of this behavior, we don't go anywhere. Right? And so that's not the answer, because then the child never actually learns how to control those emotions in any environments. And so it's like, how are they going to actually go to school? And then the answer isn't just to homeschool them, because how are they going to finally work? And you could say they could just work from home forever.
Yeah. Forever. And that's not
right. So let's treat what's going on. And I understand that mental health research has come a long way. And because it's a brain, we can't physically see the broken leg. And now that we have these MRIs and we're able to look at neurotransmitters and how they're sending signals and all these other things, now we better understand what's going on so that we can better explain it, give proper treatments. And so it's come a long way. So even with how grandma felt with certain medications, or even mom or dad, we have new data coming out all the time. And so I tell people, give it a chance. Right? Let's see what's going on. And one of the things that I always tell my families is, tell me what's happening.
Be honest with me.
Be honest. If they're having side effects, I want to know, because I can change it.
Yeah, for sure.
And I think that's the key, is when you walk into an office, don't just say, well, this is the way it has to be, and my child is sneaking and not taking their medicine because it gives them an upset stomach. You have to communicate that to whomever is treating them, because it's very important. And so, we know that there's sometimes delays in diagnoses, but some of that can just be pure bias, right? Yes. And we know that especially within the African American community, bias and delays in mental health diagnoses is huge. This was 2 days ago, 18-year-old came in and said, I think I have ADHD. I said, baby, where you been the past, since you were 6, right? Or middle school. Right. And she said, well, my mom said she felt like I've always had it, but they didn't want it to go on my record. And I'm like, now you're starting college. And your GPA could have been higher, which means you probably could have got a full ride to college. And so it's like all these things and these stigmas, but I know some of it is us not disclosing. But this particular girl falls in that category of the slightly okay performing, quiet young lady who does what she's supposed to be told. And so she's not bouncing around the room. She's not getting into fights. She's not disruptive. And so she falls under their radar. It doesn't get a diagnosis.
That's exactly right.
So what are some other things that you see that might be a bias?
Other biases for sure would be families and their beliefs.
True.
Their cultural beliefs about mental health. And a lot of people are just so afraid of the stigma of a diagnosis. But my thing is, a diagnosis helps you to understand what the problem is, to have a better strategy. Because it's really the strategy that's the problem.
Right.
It's the poor coping skills. It's the poor support in the classroom. We just need to implement different strategies to support children in their education, at home, help them with emotion regulation, so many different ways. Another bias is socioeconomic bias, not having access to services. Not a lot of providers are taking Medicaid, and that kind of restricts the access for certain individuals. Then there's confirmation bias, physicians' overuse of scales as opposed to scales are helpful to help us to understand if this is a screening. We're screening with scales. Some physicians can use that solely to diagnose, but there should be more consideration developmentally in the family, what's going on in the family.
Environment is huge.
Environment is
it's so
ginormous.
big.
Yeah.
And because we talk about it all the time, screen time. There's so many kids I take away their screen time and they act right.
Yeah, and that's the hard part because screens are everywhere. We're on a screen right now. The kids they have smart screens in school. There's television, cell phones, iPads, and that's such a tough thing to navigate.
But it's one of the things that we have to look at the environment. I recently had given an example when I was doing a lecture about how I had seen a young lady who had severe anxiety. She was on up to about 3 minutes. Okay, for anxiety. One of those would just make you sleepy, you know what I'm talking about. But 2 other ones that were for real. And I wasn't treating her for her mental health stuff. I just saw her PCP. And one day I just asked her, like, how do you sleep? Oh, I sleep horribly. Okay, all right, let's get that down. Do you drink a lot of caffeine since you don't sleep well? I drink some. I'm like, okay, what do you drink? I drink Dr. Pepper. Okay, when do you drink it? I get a 32 ounce in the morning before school. At lunch, I get a 20 ounce. When I come home, I get a little bit out of our liter bottle, and I might drink 1 can before bed. When we added up, it was about 120 ounces of Dr. Pepper. Okay, goodness gracious, right? Was right. And I think previously she'd kind of been asked, like, do you drink caffeine? Don't drink too much. But it wasn't like delved in. Like she didn't think it was that much.
Yeah.
So sometimes it takes just having someone who asks just a little bit more. And so now that we've been able to wean her off, she does like 1 every other day. She's not on any anxiety meds. But she does have a good therapist. Don't get me wrong. She does need some.
Right. The intensive therapy is a great option for anxiety.
Exactly.
Cognitive behavioral therapy is really effective and pretty consistently efficacious for the treatment of anxiety. And it should be the first place that we start.
Yeah. And
with lifestyle changes.
No, definitely. And so I think that it's so important. Do you mind, since we kind of touched a little bit on cognitive behavioral therapy, just sharing a little bit more, because parents get confused because we're like, oh, we want you to do PCIT or CBT or trauma focus. Can you just tell us a little bit about some of the therapies that you may recommend or even do for your patients?
Sure. So for anxiety and depression, there's cognitive behavioral therapy is a way to work on changing your thoughts, which ultimately can help change your feelings and ultimately change your actions. And sometimes, and a lot of so there's the cognitive part, working on your thoughts, reframing your thoughts. Our thoughts cause our feelings. So if I say to myself, I'm depressed, I'm sad, that's going to make me feel depressed. Or if I say to myself, I'll never be worth anything, I'll never make it in life, that's going to cause me to feel sad and depressed. Versus if I say to myself, well, things are tough right now, but I'm working on it. I'm doing my best. I have this plan and strategy that I'm implementing that makes me feel a little bit more optimistic and more hopeful. And through coping strategies and kind of retraining your brain over time, over 6 to 12 sessions, you can see a lot of improvement with depression symptoms. Other therapies that can be really helpful for kids is EMDR. This is a therapy that can really help kids that have a lot of trauma symptoms. It kind of helps to separate the emotion from the tragic event. And it kind of helps to just decrease the internal sensations that we can feel and think about when we're reflecting back on all of our traumatic things like nightmares, hypervigilance, exaggerated startle reflex, and then also those kind of negative thoughts that we can have about ourselves, feeling shameful or feeling guilty for things that we had no control over. So EMDR is a really effective therapy.
Is that something that you do? Are you able to?
I don't have the training for EMDR. It does require some specific certification training.
Right.
But a lot of therapists do have that training. As a psychiatrist, I mainly focus on medication management, just because that's how I was trained. But I do a lot of brief interventional therapies. What are some other therapies? PCIT is really helpful. Parent-child interactive therapy. That's really helpful for kids under 7 years old that are having a lot of behavioral issues with like defiance, rule following. They may struggle with the family. And so what happens is it's really kind of coaching for parents to kind of coach them through how to handle tough situations with the child present so that they can practice at home. And that's really effective treatment.
Yeah, the one thing I use PCIT often, I recommend people have it. But it's interesting because I have a few patients who they act like perfect little children.
Oh, yeah.
In the sessions, and they go home and they're like, ah!
Yeah.
And so the parents are like, I'm not learning anything. And it's interesting because you're like, okay, well, what is truly in this environment? Right? Where the child can completely control it in one space, but in the other space. But they still give those parents a lot of tips because they'll come back and tell them, right, on how to address those situations. And one of my families, they actually have their therapist's number. And so when it starts happening, sometimes they'll record it or they'll go live so she can see. And then she advises the mom in that scenario. Now, of course, not everyone has that kind of access, but this particular therapist, she did that for this family because the child was harming the sibling as well. And so we were really trying to work hard on that. But it's been beautiful to see that mother and how she speaks to him when he's having the tantrums or when he's doing these things versus just yelling at him or swatting him or whatever, you know, because that, I mean, to be honest, that's what, when we get frustrated and we don't know what to do.
How to regulate ourselves.
Exactly. And so it's like you blow up yourself because you don't know anything else.
You haven't been modeled. You've never seen another way to respond to a frustrating situation.
Right. And that's why it's so important that this new generation of kids, they're all in touch with their feelings. They got AI, you name it.
Yeah. Very vocal.
Very vocal.
And I love that for them.
Yes. And I love it. But the reality is that how we respond has to be different.
It does.
Because they're not going for that. And these children are not, you can't, grandma's like, well, just spank them. These kids are like, you're not going to spank me.
You're not going to spank me.
And the spankings don't work. And this is why they don't work.
Right.
And so I find that it's really a turning point in mental health. People are becoming more aware of it. But at the same time, when we teach people and give people some of these skills, they become more resilient and they're able to actually manage these mental health disorders or difficulties, right? Because sometimes these things are very temporary due to a trauma or just a change in our environment, especially with children. And sometimes we don't think about it, but with divorces or death in the family, I recently
had disasters.
Exactly. Natural disasters, especially here in Oklahoma. We, as adults, we're just like, it's Tornado Alley.
Yeah.
But these kids are like, what in the world?
Right. And global warming is a real thing.
All of it, right? And they're like, what is this? And their little brains their little brains aren't able to process it in the same manner that we are. But we forget that, right? Our frontal lobe has all the connections, hopefully.
a little bit more developed, some more than others.
And so it's a little bit difficult for them. So, you know, as a child psychiatrist, and I know the bulk of what you guys end up having to do is management because it's difficult, right? Every child responds differently to medications. There's lots of side effects, interactions. And if children have other conditions, you have to know, you know, how not to make this blow up, right?
Yeah, for sure.
The situation. So, you know, what is your approach for families who, you know, you've done all these other interventions, you're doing the therapies, et cetera, and you're like, this kid really needs a medicine, or this kid needs a medicine just to do the therapy.
Right.
And if they're just really apprehensive, how do you approach that in helping parents just better understand why it may be needed?
Just, again, getting curious about what the parent is aware of, like, what is their understanding of the disorder? And then I kind of delve into, like, how did we get here? Like, is there, because usually kids come to me when their functioning is changed. Yeah, I mean, no one's coming here because everything is going well. People are coming here because grades are not going well. Friendships are poor. The family life is disrupted and it's really difficult, whether that's ADHD, whether that's depression or sadness. And I'm treating people's babies. So I always keep that in mind. And so I start with, this is what I think is going on. This is how we typically treat. And I'm heavy in evidence-based medicine. So I'm always giving studies to back up why I'm thinking the way that I am. And I feel like that helps a lot of parents feel a lot more comfortable. I also give more than one option for treatment. I don't mind doing a trial of lifestyle changes if their functioning is not impaired to where they're a danger to themselves or others. But if we're at that point to where they're not going to school, they're refusing to go to school because they're so highly anxious, they can't even leave out of the house. They won't go. They will fight you in the car. They won't get out of the car. I've had kids like that before. Or they just won't talk. They won't talk. They won't engage. They don't have any friends. They're so sad inside. It's really a functioning issue. And so when I explain it that way, sometimes parents are like, okay, I see what you're saying because I see the same thing at home. And then we talk about, again, medications. And I'm always giving more than one options because I feel like I would want to know all the potential options that we could do. And usually that's like 2 or 3 potential options, at least a place to start. And then I also really think it's important, I don't think doctors do a really good job at this, unfortunately, is I explain side effects. And I give a spectrum of side effects. Yeah, because I want to know, again, I'm taking care of people's babies. So I would want someone to tell me all the side effects. And I explain certain kind of scary side effects, right? There's a black box warning for increase in suicidal thoughts with some antidepressants. And some families are like, whoa, what's this about? Why would I let my child take this medicine? And so then I will explain, well, there was a study done in the early 2000s, and there's a medication called Paxil. That's probably not what we're using today. But with that medication, at the beginning of the study, 2% of kids had suicidal thoughts. They introduced the medication that increased from 2% to 4%. So the FDA got really concerned about that. But in context, that's 4 kids out of 100 had an increase in suicidal thoughts, not attempts, just thoughts. And what happened was psychiatrists and family medicine doctors, pediatricians got really nervous and stopped prescribing antidepressants. And what did we see in the country? Suicide rates went up. And so it is a risk-benefit discussion, right? And that most times they're helpful as opposed to harmful. But however, if this is happening, I want to know about it. And if it's happening, if we're starting a new medication or we're increasing a dose, it's likely to happen around those times. So I just give a lot of education so that parents can feel confident to know what to expect, what I need to look out for, what I need to monitor for, and at least so they can make a informed decision.
No, and that's huge because I think that the majority of the people stopping medications and things has to do with the fact that they weren't told up front what they might experience. Right. Or all the psych meds have a bad stigma because nobody knew the side effects. I tell people all the time, if you were to actually read the side effects of Tylenol, you may not take Tylenol because Tylenol causes liver failure if you have too much of it, okay? Which some of us, unfortunately, people just will give Tylenol. I'm like, whoa, it literally can destroy your liver, okay? So just like with any medication, you need to know the side effects. And I have been really pushing that recently with a lot of my patients because some of the situations, one, they don't know what the medicine's treating. Right. And they don't know the side effects. Right. So if your child is on Risperdal and you don't know the side effects, that's a problem. That's a problem.
It's a huge problem.
It's a huge problem. Right. It has so many side
effects. So many things that actually need to be monitored. Yeah. Weight, blood pressure, pulse, sometimes EKGs, liver enzymes, lipid panels, your good and bad fats. There's so many things that need to be monitored. And sometimes I feel like patients and families are not well educated. And I'm very upfront and very honest about what to expect with these medications. And I'm very transparent about this is a powerful medication. This is a helpful medication for some, depending on what the diagnosis is. But this is a powerful medication, and we really need to have a serious discussion about the side effects and how we're going to monitor this and implement strategies if we have to. So I do my very best to be very open and honest and transparent with families, and usually that's well received.
Yes. And I think that's another thing. Like if your child is on an antipsychotic medication, they definitely are supposed to have regular blood checks based on, what their numbers show, right? I'm not going to give a number because it just depends. It'd be 3 or 6 months. But there should be questions about, do they have any dry mouth? Do they have any we should be asking these questions, which are trying to see if they're having a lot of side effects, especially before increasing or adding. Absolutely. And it's tough to find someone to help with mental health stuff, okay? And the reality is that there are I'll just say it. There are a lot of people who are not, they don't have your training. They don't even have my training, okay? Who have opened up clinics and things like that and are treating XYZ. And sometimes that can be okay. But in the pediatric world, you have to understand growth, development, normal development, right? And you have to really understand this, how they metabolize things faster, understanding the dosages. Because what I see a ton of is additional polypharmacy without maximization.
Yes. And that frustrates me so much. Again, these are babies. These are people's children. And that just hurts my heart sometimes. I had a kid. She was on just a ridiculous amount of medications, more than 5. Oh, and they didn't really, it just, sometimes I get these interesting medication regimens and I'm like, well, what's going on here? What's really going on? And for me, I like to get it right the first time if I can. I'm not perfect. No one is. But I like to ask all the right questions. And this young lady actually was bipolar.
So she was
She was bipolar disorder, had bipolar disorder. This young lady actually had bipolar disorder. And so she was taking an antidepressant, which is not how you treat bipolar disorder. It actually can make more depression, it can make kids have more depressive episodes and more manic episodes. And I'm always, again, explaining this is what mania looks like. I know everyone thinks that bipolar disorder is like
highs and lows. That's not what it is.
And I mean, it is to a certain extent, but that's not fully what it is, right? And it's not second to second. It's day over days. And so just, again, really explaining, also asking how parents feel about the diagnosis. Does this feel right? Does this resonate with you? Is this what you've been seeing at home? Because if it's not, then I'm wrong.
Right. And that's so true. That happens all the time. I'm like, is this making it?
Yeah. Does this resonate with you?
And if they're like, I'm like, okay, let me rethink that. But you brought up a very interesting case because I had a 18-year-old patient, right? So typically bipolar is your adolescents, older kids. And she had been treated for depression for a while, okay? And then one day came in my office for a follow-up and I realized she was talking to somebody, but it wasn't me. And I'm like, who are you talking to? What are you talking about? I'm not talking to anybody. But then it kept happening. And I was like, hold on, you're talking to somebody. Have you on this antidepressant? And so of course if it's mania, you can have a first break, right? It could be schizophrenia or it could be bipolar. And several states have first break programs where they take people in and they help them immediately, right? Because psychosis is very damaging to the brain. So it's not something you just sit on. You want to make sure that those people are actually getting treatment because over time, their outcome is worse if we just sit on it, okay? So I do want people to understand that if you have that concern, make sure someone is being checked. So this particular lady, we ended up getting her admitted. She kind of knew all the right things to say. And I'll never forget a good friend of mine when they went through their bipolar mania. I realized you had to spend 2 hours to see it. But if you spend 1 hour, you might not. And then they continued her on the medicine. But that's when I called and said, no, I know I'm just a pediatrician, but this is mania. Take her off of that. And eventually they did. And then they saw some of that improve. And of course, they got on her right medications. But, these are some of the things where if you have that gut feeling or you're noticing something and the person that you're seeing may not see that, speak out, okay? We don't see that. We're not seeing it. If she hadn't been speaking to the wall, I would have never known. And I'm making her worse, right? And so if you're seeing these things, make sure that you're calling your doctor or nurse practitioner or even PA, right? And you're letting them know this because these things can be really harmful long-term. And we want to make sure that we're treating, especially psychosis, okay, very quickly.
And not all symptoms of psychosis are truly organic psychosis. Exactly. Some kids have experiences that we may not fully understand, but they may describe them as I hear voices. But when you further investigate, really, it's just their internal monologue that they're just not as familiar with. And so we just have to be really careful and do a really complete, thorough exam to make sure that you're on target as far as treatment options are concerned.
And definitely your histories, right? Because some of these kids will be taking some stuff.
Right, yes.
Which will trigger some of these thoughts and things like that. And I think for me, majority of my patients who have hallucinations, who are older, is depression, right? And once their depression is managed better, the hallucination of the thoughts go
Anxiety
away.
even too.
Yes.
PTSD.
Yeah, unfortunately, I don't have a ton of, I have some PTSD, but, in the adult world, of course, it becomes a lot more. But, I think that we have to just kind of break the stigma, because can you imagine just every day your mind is just racing. Your mind is just all over the place, disorganized, etc. And you're struggling internally, but you may not even have the words to convey it, right?
It's hard to explain.
Very hard to explain.
And how you feel. And that's called alexithymia. It's hard to say, I'm depressed. I'm sad.
I'll never, during COVID, I had anxiety and I couldn't explain it. And I was like, it's something, right? But I obviously diagnosed and treated, and I'm like checking off my criteria, like, oh, that's what this is. Never had it before. Developed it due to there's a good reason to develop in the situations that we were in. But it was so weird. It's such a weird feeling. And I definitely developed flying anxiety. So I share this sometimes because I always had to use the bathroom before flights.
Good idea. It's a good practice in general.
It is. But I would have to run to the bathroom before flights, right? My stomach would hurt. I couldn't eat. All these. And I realized, there's a correlation here. But imagine for your child, for children, they may not be able to say it, but you might see some things, right? You may notice that they can't eat before you do things, or even if it's a test, right? They're not eating the day before a test or afterwards, or you see them more subdued or quiet. And so you want to make sure that you don't just brush those things off. And we're not saying every kid needs a diagnosis. No, okay.
No. But you know your child, right? And if they're usually upbeat, happy, go lucky, skipping to the breakfast table, and then all of a sudden there's a shift, a big change in the way that they're functioning, something's going on.
No, definitely.
Something's going on, and things need to be investigated. What's going on in school? What's going on with your friends? How's your teacher treating you? Are there people that are doing things when I'm not around? Let me know. I always want to know. I'm always asking my kid, what's going on in school today? What happened on the playground?
All right. Why are you so quiet today?
Okay, yeah. What's going on? You okay?
You okay?
All right.
I'm okay.
All right, fine. That's fair.
But and of course you don't want to overdo it, right? Not to where they're like, okay, I'm going to hide in my room. But you want to have those dinner time conversations if possible, or those car ride conversations. And that also helps open up the door so that your child learns how to communicate their feelings, okay? And as well as it might build that relationship between you all, so that if they are really going through something that might be kind of embarrassing, that they're actually going to tell you. And so I will make sure that families remember to open up that communication, not just a text message, how you doing, but actually that verbal communication, because eventually they may want to talk to a therapist or something like that. But if they're not even used to talking to you, sometimes that can be difficult for them. And so just something to really pay attention to. So, we could probably sit here all day because she has lots and lots of knowledge, and I would love to just take it out and put it in my head. But are there any final words that you would like to share with our audience?
Yes. Parents, the best way I know to develop and to build resilience with your children is to spend time with them. And it doesn't have to be a lot of time. It can be 10, 15 minutes, letting them guide the play. That is so impactful. The second thing that I think is important to say today, parents, we have to take care of ourselves. And when I say take care of ourselves, I'm not talking about getting your nails done. I'm not talking about trips to Dubai. I'm not talking about a new car or the work that you have to do. I'm talking about, how are you pouring into yourself? What, are you taking time to reflect, be mindful, be present? Are you present? Have you addressed your mental health? Because the truth is, if parents aren't doing well, your children aren't doing well. And I have that experience myself. I was diagnosed with ADHD at 35. So that means I went through elementary school, high school, college,
residency, fellowship.
Yeah. And if it wasn't for therapy, during the pandemic, I had similar situation of just like having a pause in life, right? And just kind of reflecting, and just having gone through residency and fellowship and kids and marriage, all these life changes all at once. And I finally took the time to pour into myself and realized that I did have anxiety. And my therapist was like, but you also have ADHD. And I was like, I don't have ADHD. How could I have ADHD? How could I have ADHD? No, but she was right. She was right. And I'm grateful that she told me that, because it opened the vortex in my mind to realize, oh, my mom was late all the time, not because that was just her personality. She had ADHD too. Yeah. And now I have an ADHD family, and it's fine. But I'm so grateful that I took the time to take care of my mental health so that I can be a better mother, a more present doctor, and really step into the gifts that God has called me into. So I just feel like it's really important to be transparent. And it's something that I do a lot in psychiatry. I know that's kind of sometimes it's frowned upon, but I think that it builds rapport and
it humanizes you too.
It makes me human, and people feel more comfortable. So they do tell me what's going on. They do tell me what side effects they've had. I'm not liking this medication. I want you to tell me. And I'm very open and honest with all my patients with across the lifespan. I want to know how you feel about the medicine because you're the one that's taking it. I'm not. And I want it to help. I don't want it to cause harm. So those are the things I would say are really important.
I love it.
And take care of yourself, and your mental health is so important.
I 100% agree. It's something I'm working on, but definitely 100% agree. Now, how can they find you if they want to know more about you or the practice if you're in Tulsa?
Sure. Yeah, so my website for my clinic is bewellpsych.com. I'm on Instagram, Facebook, and TikTok at dr.Ranelle, RANELLEBEWELL.
Nice. Well, hopefully you all will follow Dr. Ranelle online because she gives a lot of great tips and information for you to ponder on. And as always, it has been a pleasure. I'm so glad that you are tuning in to Raising Resilient Minds as we work on changing the trajectory of children and making sure that they live very full lives. So until next time, I'm Dr. Jihan. Bye-bye.